Okay, well, thank you. Thank you very much, Ashley. Good morning, good afternoon, good evening, wherever you may be in the world. My name is Al Freedman. I am truly honored to be here. I'm coming to you live from Northbrook, Illinois, a suburb of Chicago. And for the next 45 minutes or so, I'm going to be sharing with you some thoughts on supporting the mental health needs of rare disease patients, families, and communities. I come to this presentation and this work for two reasons. First, I am a practicing psychologist. I specialize in supporting the mental health needs of our rare disease communities, and that's why I'm here today. In my work, I provide psychotherapy, individual counseling sessions for patients, for caregivers, for family members, for siblings who are affected by rare disease. I also support rare disease advocacy groups by facilitating support groups around the world for a number of rare disease advocacy groups. I just had one today, and I'll have another one later today. And it's such a privilege to work with groups of rare disease patients and caregivers. And I also provide a consultation to rare disease advocacy group leaders and communities who are building programs to support the needs of their community members. And finally, I work with industry partners to help industry partners understand the needs of our families and connect with our families as they get involved in developing treatments. So my work is far ranging, and I feel very privileged to do the work. The reason I come into the world of rare disease, and I'm here today, is also very personal. I'm a dad first and a doctor second. Um, I have, I'm going to try to make this slide move. Here we go. On the left, my two kids. My son, Jack, was born in 1995 in Madison, Wisconsin, a healthy 8.5 pound baby. But at the age of 6 months, at his pediatrician appointment, the pediatrician noticed that Jack wasn't sitting up and wasn't rolling over. And in the space of 4 days, we went from having a healthy 6-month-old baby to having a baby diagnosed with, at the time, an untreatable and uncurable neuromuscular disease called spinal muscular atrophy. And Jack, as a 6-month-old baby, was given 1 year to live in 1995. And thankfully, Jack didn't cooperate fully with his prognosis. He lived to the age of 26. He passed away 3 years ago this month. Riding on the back of Jack's wheelchair in that photograph on the left is my daughter, Kara. Kara joined our family in the year 2000 as an adoptee from Korea, 4 months old. She's a wonderful young woman now, all grown up, and actually works in rare disease herself at the National Organization of Rare Disorders in the patient registry department. So I come to this work first as a dad who was fortunate enough to have a son with a rare disease and to be with him for 26 years. So I come to this work with a lot of humility and a lot of gratitude and a lot of appreciation for the challenges faced by families like mine and like yours. Over the years, the rare disease support group that we belong to, my extended family, is called Cure SMA. And as a psychologist, a symbol of my professional work is the support group you see on the right-hand side of the screen. This is at our Cure SMA conference a few years back, and it's a group called Talk It Out, where our kids, adolescents, young adults, each have the opportunity in groups to talk about how they feel about the experience of having this condition. I've been privileged to co-facilitate these groups for over 20 years and now doing groups online all the time. Since the pandemic, the world has changed and the ability to reach out to many people in the rare disease world has changed. My license to practice used to be good only in one state where I lived in Pennsylvania. Now I live in Illinois and my license to practice is good in 42 of our 50 states. So I'm able to see rare disease patients and families all over the country, both individually and, as I said, in groups. This is an in-person group. Many of the groups that I lead now are online. All of them, except for at conferences, are online. So I come to this work both professionally and personally. And what I'm going to share with you today are First, some of the common challenges I see when serving families like yours and mine, and serving leaders of advocacy groups like yours, in my work as a professional psychologist, supporting the emotional and psychological needs of our families and our patients. I'm going to talk about common challenges because the most common question I get as a psychologist is, Dr. Al, is it normal? Is it normal that I blank? Is it normal that I feel scared? Is it normal that I'm worried all the time? Is it normal that I'm not sleeping or eating or having fun doing the things I used to have fun doing? A wide range of questions. Is this normal? So I'm going to share with you to start some of the common challenges I hear every day in my work as a psychologist. And then I'm going to talk about some of the solutions to those problems that um, are really important in order for us to stay healthy and to move forward in our lives. First thing I'd like to mention is the word trauma. The rare disease journey can include the experience of trauma and also vicarious trauma for leaders of advocacy groups. I can tell you that when my baby was diagnosed in 1995, I felt very scared, overwhelmed, disoriented, like I'd been launched into outer space, into a world that nobody else could relate to or understand. And it took me many weeks and months to get my feet under me emotionally and to adjust to the new world that I lived in. The baby that I thought I had wasn't the baby moving forward that we were going to be taking care of. Our life changes and flips upside down when we find ourselves affected by a rare disease or find ourselves with a family member affected by a rare disease. And when we are close to the communities of other patients and families, and when folks like some of you lead organizations, it can be very traumatic when you get close to the families you care for and someone passes away or somebody is sick. And the vicarious trauma is real for our patient advocacy group leaders as well as for our patients. There are different types of trauma. The trauma from the diagnosis, there's trauma, medical trauma. We spent 350 nights in the hospital during Jack's 26 years, and it's not an easy way to live. People experience trauma when they have a rare disease and are not believed. Some invisible, physically invisible diseases are very real, and some people experience trauma because they're not believed. So I start with trauma because it's where my personal experience started on November 7th, 1995, the day of my son's diagnosis. But that's one of many ways that trauma can unfold. A second very important theme that I hear in my work as a psychologist is the theme of uncertainty. No matter what the rare disease is, no matter what country the person lives in, no matter the culture, this concept of uncertainty in my work cuts across cultures, countries, and rare diseases. When we find ourselves in a place of uncertainty, it's anxiety provoking because we don't know what the future will hold. Much of the work I do with individuals in counseling, it focuses on an existential level of uncertainty. This is also expressed in rare disease support groups. Where do I fit in the world? Where is my place in the world? How long will I live, or how long will my family member live? There are some very big existential questions that come when we cannot predict the future. Of course, none of us can predict the future, but when we have a rare disease, everything becomes even more uncertain than for the average person. And that brings about many, many feelings. There's also the uncertainty on a day-to-day basis. In addition to the existential level, what will the future hold? And where is my place in the world? Many of us have to deal with the day-to-day uncertainty of, for us, it was, will our baby's cold turn into a life-threatening illness and we will live in the hospital for a month in the intensive care unit? I spent 20 years with a suitcase full of 3 days worth of clothes and a toothbrush in the trunk of my car, not knowing when we would end up in a hospital. I had to worry about when the nurse would come. If the nurse didn't come for the night shift, then I was up with my son from 7 p.m. to 7 a.m. Every 12 hours, there was uncertainty about the next 12 hours. So uncertainty is a difficult way to live, but it's common in our experience with rare disease. Many of the patients I work with experience isolation. The whole world experienced isolation during the pandemic and got a sense of what that was like, and it was not fun for anybody. Patients that I see as they get older, especially, find themselves by themselves a lot without a lot of connection. And isolation can lead to discouragement, which also can lead to depression. Connection fights against isolation. So we want to be finding connection wherever we can to fight isolation. Related to this is social relationships. Um, Many of the rare disease patients I interact with, both individually and in group settings, talk about the challenges of establishing, maintaining, and sustaining social relationships. Having friends is a big deal for all of us. Who can we count on when the chips are down? Who helps us feel included versus excluded? Interacting with other people in the world is a core experience that we all deserve to have. When we have a rare disease, sometimes it's hard to maintain those social relationships. It's especially true for patients I see who have significant physical disabilities. I see a number of young men, as an example, who have muscular dystrophy. And as they get older and their friends get older and they finish school, others move on with their lives in ways that rare disease patients often can't. And many feel left behind. Having romantic relationships, sexual relationships, very complicated for rare disease patients, very, very challenging. These are some of the common challenges that I help with on a day-to-day basis, and they're very common in the world of rare disease. Friends mean everything. Rare disease, the rare disease emotional journey um, has much to do with the visibility or invisibility of a rare condition. My son used a wheelchair, and for the last 6 years of his life, had a trach and a ventilator and a lot of medical equipment. So when Jack drove his wheelchair in public or into a room, everybody could see that he was different. We have to then respond to people's reactions to us and our family members when people are not used to seeing a child with a wheelchair or an adult with a ventilator. That is challenging in a different way than it's challenging for people with rare diseases that are invisible. I work with a number of patients and groups with invisible, especially autoimmune diseases, and the emotional journey is impacted for invisible people with invisible disability quite significantly because a person looks like everybody else, acts like everybody else, sounds like everybody else. There's no visible difference, but many of you and many of my clients are suffering from rare diseases that impact quality of life and are very, very real. But when you don't look like you have a disability, people don't take it seriously. That can be very impactful for your emotional journey. It's a very common problem that I hear about in my work. All of us, all of us want to be independent. All of us want to do for ourselves what we can do for ourselves. All of us want to take care of our family members. All of us as parents want to take care of our children and be responsible as parents. When we have a rare disease, we find sometimes that we can't do it all ourselves. Jack's mom and I realized quite quickly that it was not going to be possible to take care of our son who has spinal muscular atrophy all by ourselves. That's a hard pill to swallow for many people that I work with. We all want to be independent. So it's important that we figure out how and when to accept help. And it's a common challenge also to be doing a bit of a calculus. Is the help we're going to accept worth the intrusion? That's especially true using an example of nursing in the home, which we had with our son. Was it worth the intrusion of a nurse in the house to have the benefit of the nurse in the house with another pair of hands to help us take care of our son? The intrusion was real. It was complicated. And accepting help comes in many different forms, not only that particular example, but many different forms. Accepting that we have a rare disease also means accepting that we're part of a community that we didn't choose to join. The Cure SMA group is a club that I'm proud to be a part of now, but I didn't choose it. It's a club none of us choose to join rare disease, but we are part of the club. So learning how to be part of the community, learning how to accept help from others, from doctors, from nurses, from professionals, from the communities where we live and work isn't easy, but it's an important skill that I help with in my work. I find it I find it interesting when I hear the phrase unaffected siblings. And obviously the context is the brother or sister of the rare disease patient is not affected by the rare disease medically. But siblings are not unaffected by rare disease. They are affected by the emotional experience of rare disease. I work with many, many siblings and have conducted groups with siblings, both children and adults. Siblings are affected in very profound ways. And it's a mixed bag for siblings. My daughter, as an example, as a sibling, is one of the most independent, thoughtful, um, open-hearted, uh, and kind people. She was very protective of her brother, and now works in the rare disease world as dad does. She was profoundly affected by the experience of growing up with her brother. Every sibling I meet is profoundly affected, and it's for both better and worse. Siblings' needs can't be attended to in the same way sometimes because moms and dads have their hands full with the child with a rare disease. So it's really important for siblings to have the full attention of their moms and dads whenever they can so that they can have mom and dad's attention and they can share the gifts that they have in the world independently of the sibling who needs extra attention. It's a great challenge, and siblings are also a great joy. Many parents who have babies with rare diseases ask me if they should have another child because the challenge of taking care of a child with a rare disease is so exhausting and so overwhelming. Um, and typically, it is very healthy for parents to expand their families and have another child for the same reasons that a family would expand without a rare disease. Uh, Siblings are affected too, a very common challenge in the work that I see. Another topic and another source of stress for families affected by rare disease and patients is navigating systems. Navigating our healthcare system in the United States is a very complicated thing to do when you don't have a rare disease. And it's especially complicated to do when you do have a rare disease. Interacting with doctors and the system can be really stressful. Doctors and nurses and healthcare professionals, in my experience, choose to become doctors and nurses because they want to help other people. And they're working in the same complicated, difficult systems that we're trying to utilize as patients and family members. It can be frustrating, it can be overwhelming. But although it is frustrating and overwhelming, we need to learn how to navigate those systems and interact with our doctors and nurses the best we can. I had spent 26 years running interference with my son and for my son, with his doctors, his team of nurses, both at home and in the hospital. Dealing with health insurance is another system. IEPs for children with special needs in a school system is another source of stress for many families. And interacting with government systems for Social Security benefits, disability benefits, all very complicated, all very frustrating. And it's a skill set that people need to have in order to navigate the world of rare disease. Sometimes I can share with you that in counseling sessions, individual and group counseling sessions, this is a topic that's discussed. So it's not about psychological issues. It's about the practical day to day, how do we deal with this system? and people need support. How do I deal with this system? Another source of stress is I use a quote here, blank just doesn't get it. This is something Dr. L, a therapist, hears all the time. And a lot of different things can go in the blank. The doctor just doesn't get it. I know more about my rare disease than the doctor does. My husband or wife just doesn't get it. They're off at work and I'm taking care of my child or children who have a rare disease. The other parents in my neighborhood just don't get it. Their kids are out playing soccer right now and my child can't walk. It's very hard for me to relate sometimes I hear with others in my community or in my social circles who don't understand what it's like to be in the world of rare disease. Back to the point about visible versus invisible. There are many people who struggle with the challenge of having an invisible rare disease and not feeling heard, not feeling seen, not feeling understood. And when you're suffering from a rare disease and have real symptoms and other people don't respond in the ways you need or don't hear you or don't believe you, it can be very, very stressful and very, very frustrating. I hear about this sometimes. Once in a while, I'll hear, Dr. Al, I really uh, liked my therapist before I met you, but the therapist didn't get it because they never had any experience with rare disease before. It's hard and stressful. I felt the same way as a parent for many years, especially early on, that others didn't get it. And then as I, in my old age, I started to figure out that it really wasn't fair to expect other people to get it. If they were too far removed from the situation, didn't have the opportunity to um, be exposed to the unusual conditions that we are when we're affected by rare disease. But it's very stressful. You feel alone when other people don't get it. In terms of mental health challenges, there are mental health challenges that are associated with the rare disease itself. There are some rare diseases that come along with behavioral issues or neuropsychiatric issues that are part of the rare disease itself and the symptoms that come with the rare disease. And these are special situations for me as a psychologist because the person experiencing these mental health challenges has experienced the rare disease itself. And this is separate from medical symptoms that are more common with rare disease. Sometimes there are psychological or psychiatric or behavioral symptoms that come with rare disease. And then side by side with that comment and observation is that I often see people who have mental health challenges that are actually unrelated to the rare disease. And I want to expand on this a little bit by explaining that uh, there are people who have a genetic predisposition to depression or anxiety or other mental health issues that is kind of wired into their families biochemically that have nothing to do with a rare disease. In my work as a psychologist, I see plenty of patients who have family histories of anxiety or depression that come for no reason other than their biochemical makeup. Once in a while, I'll see a client who has a rare disease uh, and who also has a second problem, which is a family history or genetic vulnerability biochemically to anxiety, depression, or another rare disease. So in my work, I'm sometimes sorting out, is there one problem or two problems? It's easy as a therapist to see somebody who has a visible rare disease, a person like my son who has a wheelchair and a ventilator, and make the assumption or presumption that 100% of that person's mental health challenges are because of the situation, the stress of limitations that come with that rare disease. Sometimes, not all the time, but sometimes that same person who has a visible physical disability also has a predisposition to mental health challenges unrelated to the condition. So my work sometimes involves teasing out, is there one problem? Are there two problems? Obviously, having a rare disease is stressful. You don't need a PhD in psychology to know that. Obviously, having a child with a life-threatening condition, as I did for 26 years, is stressful. You don't need a PhD in psychology to know that. All of our lives are going to be stressful when we have rare disease. And when I have that question, Dr. Al, is this normal? Is it normal is it normal that I uh, can't sleep at night? Is it normal that I'm thinking that because something bad happened with my child being diagnosed with a rare disease, is it normal that I'm thinking that something else bad is going to happen? Is it normal that I'm crying? Is it normal that am afraid of the future? Is it normal that I get so anxious when I think ahead 5 years? And the answer to that question is usually yes. It's a normal reaction to a very unusual and acute set of conditions. You don't need a PhD in psychology to know that when you have a rare disease, life is going to present challenges and life is going to be difficult. I want to move to a little more discussion about solutions to this problem. The first thought I want to share with you is not about being a psychologist specifically, but for the rare disease patients and families and groups that I work with, the most important ingredient that a person needs is hope. When Oftentimes when we receive a rare disease diagnosis, we don't receive a whole lot of hope. When my baby was diagnosed back in 1995, we heard a lot about what baby Jack would never be able to do. He wouldn't be able to walk. He wouldn't be able to sit up. He wouldn't be able to talk clearly. He wouldn't be able to swallow food safely. He wouldn't be able to get over a cold without stuff getting in his lungs. And he wouldn't live for more than another year. The doctors left us with a lot of information, but not a lot of hope, almost no hope. We had to find hope from other places. The doctors see kids like mine when they're not doing well. They don't see them every day, and they don't experience all the good days that we have. So we have to reach out and find hope in other places when it's a scarce commodity. For me and a lot of people that I know, folks like us who are affected by rare disease find hope from other people who have walked the path that we're about to walk, especially when somebody is newly diagnosed. So we find ourselves with role models, people who have the same condition or families affected by the same condition, who have managed to move forward in their lives with grace and with dignity and with hope. It's those role models that we all need to find and count on to help us have fuel in our tanks emotionally, knowing that fuel is going to be expended from our tanks more than from the average person. So we want to spend our time around other people who are hopeful and who can lift us up. And that's true whether you are interacting with a mental health professional formally or not. I'm talking about everybody all the time and not specifically about interacting with any mental health professional. Hope breeds hope. Many of you, as I am, are part of rare disease communities. I just returned from a conference in North Carolina with a rare disease community that came together, and the positive spirit was very palpable in the room of a few hundred people. And I was honored to give a talk in that meeting room and then hold a workshop. When we are together in rare disease communities, we get stronger and we get connected. And it's important for all of us to connect with our communities, to stick together, and to be supportive of the people who have the courage and the strength to lead our rare disease advocacy organizations and communities. If I had any one piece of advice or guidance for any rare disease patient and family that I see individually, it's to get connected with others in the community who can relate to your experience and give you strength, give you hope, give you direction, share knowledge, and be together. There is strength in numbers. This is another symbol of the strength of community. very proud and privileged to have co-facilitated these kids talk it out groups for our Cure SMA community. These children are smart, they're articulate, they are thoughtful, and they are stronger in numbers when they're together. Many of these children don't have a chance to see another children like them in their hometowns around the country. But when we are together as a group and these children are together, there's strength in numbers. The woman in the back of the picture on the right, my friend Angela, is an incredible elementary school teacher in Houston. She has this condition, SMA, and she teaches able-bodied kids in a public school classroom and has for 25 years. She and I have co-facilitated the groups for young children, for adolescents, for young adults, for parents, for many of our constituencies for over 20 years. When these children come together, they're able to speak honestly and openly without their parents in the room about the experience of having a rare disease. Every year they ask, Dr. Al, how can we get our parents to stop worrying about us so much? Every year the girls give each other advice about how to handle a middle school dance when you have a wheelchair. And often they give each other advice about how to handle awkward situations when adults who are talking with their parents talk over their heads, assuming they have a cognitive disability when they don't. They have a physical disability and they literally talk over the kids' heads. The kids give each other advice about how to handle those awkward situations respectfully, but honestly. In the back of the room there, you see my daughter next to me, all grown up as a volunteer, and my beautiful fiance, Patty, who's here with me in Chicago, is on the left. I met Patty at this very conference 6 years ago. This community is very strong, and I encourage each and every one of you to find a way to be connected with your communities and to help your children be connected to communities because there is strength in numbers. I'm going to talk a little bit about self-care. We often hear that phrase self-care. What does it mean in the context of rare disease? And I'm putting the word intentional in front of the phrase self-care. And the reason I do that is because for me, I didn't have a whole lot of time to take care of myself when I was taking care of my son for those 26 years. In fact, I could tell you that in 26 years, I didn't have a whole lot of time to talk about how I felt about the experience. Uh, I was busy keeping my kid alive, honestly, and frankly, that's what it was about. So it's very hard for all of us in the world of rare disease to take care of ourselves when we have so much to deal with, taking care of our family member, as I did with a rare disease. We're taking care of our own physical, medical, day-to-day needs. In order to take care of ourselves, we have to be intentional. We have to be very, very intentional. And for me, I take care of myself if I put it on the calendar. For me, it was running, and it still is running when I'm intentional about it. On days that I exercise, I feel better than days I don't exercise. But I had to intentionally put it on the calendar to make it happen. Everybody's different, and everybody's form of self-care is different. For people with rare disease, it's hard sometimes to exercise in conventional ways. My son got exercise being in a standing frame for an hour at a time or in water in a swimming pool with a special float around his neck. That was his form of exercise. He needed others to do it with him and for him. For many with rare disease, traditional exercise is not realistic or possible, but getting fresh air goes a long way. Getting outdoors goes a long way. Taking a walk, if we can walk, goes a long way. Listening to music, meditation, whatever form of exercise, playing music, athletics. The clients that I see have many different ways of taking care of themselves. And as a psychologist, it matters not to me what form of self-care that the client is engaging in. What matters is that it's nourishing, fulfilling, and consistent. In rare disease, what I find is that the consistency is very, very hard to come by. And the consistency is very hard to come by for obvious reasons. We have so much uncertainty in our lives. We have so many surprises where so many things in rare disease we can't anticipate. And we're all just trying to get by. But when we can schedule, be intentional, and have a routine that's predictable and that we can repeat of self-care activities, it goes a long way. It can be anything. It can be listening to music. It can be reading. It can be meditation. It can be traditional exercise, be non-traditional exercise. It can be getting outside. For me, going outside of this room is self-care because I now work remotely. I'm able to see people in 42 different states, but I'm indoors and not going out to an office. So for me, self-care means leaving this space and leaving this house and getting fresh air. And I'm not sometimes intentional enough to do that on a regular basis. We all need to be intentional. And when we are intentional about our self-care practices, it goes a long way. That's what I see in my work, and that's what I see with myself. Another very common question I receive is, Dr. Al, uh, how do I know I need mental health support? What are the signals that I should pay attention to that would lead me to reach out for mental health support? And the answer to that question is, um, if the quote symptoms, your mental health symptoms, are interfering with your day-to-day functioning, that's your signal to reach out for help. Again, I'll repeat that. If the experience you have, the stress you have, the symptoms you have are interfering in a significant way with your day-to-day functioning, that's when it's time to reach out for support. What does that mean? Interfering with day-to-day functioning. If you can't sleep at night, or you're sleeping too much, if you have no appetite, or you're eating too much, too little, too much of our basics. Sleeping and eating are two of the core basics of survival. If you're not enjoying the things that you typically enjoy, if you're sad all the time and crying, if you're thinking of death a lot of the time or thinking of dying, these are obvious symptoms of that are interfering with our day-to-day functioning. That's when it's time to reach out for mental health support. How? It's hard to do. There aren't enough people available to help in the world of mental health in general. And there are far fewer people like me. I'm looking for company. If you know other professionals who do the work I do, who have experience and an interest in rare disease. So it's hard to find therapists, but it's not impossible. I recommend to families that ask me to check with their hospital systems. When we have a rare disease, we're often interacting with doctors and nurses who specialize in that disease. And oftentimes there are people within the healthcare system, in the hospital system, who are social workers and therapists and have experience with rare disease. Also, the same people in the hospital and medical systems know the people in the local area who do have some experience with their clients and with their patients. I'm fortunate in that I'm part of a compact for psychology that allows me to practice in 42 states remotely. I'm the exception, not the norm. Most practitioners can only practice in the state where they are and where their patients are. For most of my career, I could only practice in Pennsylvania. I was only licensed in Pennsylvania. The world has changed for some of us, but only in psychology and only if you're credentialed at that level to have this compact, which is called PsyPact. If you want to read about it, psypact.org, PsyPact explains and has a directory of professionals who, like me, can see patients in 42 states. Social workers, psychiatrists, uh, master's level counselors do not have the benefit of an interstate compact yet, so they're limited to the state where they practice. So your local resources, the hospital system, the medical system you work with may know people who can help. If you have a primary care doctor, your primary care doctor in your local area may know who can help. If you're looking for help for a child, I used to be a school psychologist, a school counselor. School counselors know who the good therapists are in their local areas. And pediatricians also know where the good child therapists are. These days, it does help to be able to access help remotely. I'm busy in part because rare disease patients, I would count myself among them for 26 years. It wasn't easy to put Jack in a van and take him anywhere. So anything remote was a real gift. And many families are thankful they don't need to go to an office. Many practitioners now are able to work remotely, especially within their own state. Just a little bit about when and how to reach out for support. I would encourage you, as I mentioned before and showed you the photographs, rare disease support groups are a very powerful way to get support. I've been doing this more and more in my work, and I feel so good when I can be supportive to 10 people or 15 people at once rather than one at a time. I just met with a handful of people earlier today, and there are going to be a handful of people tonight all over the world who have a rare disease and who come together as a group once a month. Um, I wanted to explain specialized support groups. Support groups in rare disease work well when the people in the group have that particular unusual situation in common. And I put asterisks next to two of these specialized groups because the newly diagnosed patients and families need something unique and something different because of the trauma and the disorientation that the newly diagnosed patients and families feel, just as I did in 1995. I was blown out of the water, like in outer space for a few months. The folks who are new to rare disease need a lot of support, a lot of specialized support. And families like mine who've lost a family member needed specialized support and need to be in a group with others who've experienced loss. The other specialized list of specialized groups are also self-explanatory. The point being that groups like this exist within our rare disease support organizations, advocacy organizations, and I would encourage you to try them out. If you can find a group that meets regularly, what I can tell you happens, because I'm facilitating 6 or 8 of these a month now at least, is that the group becomes like an extended small family that looks after each other, checks in with each other, shares knowledge, shares feelings, shares resources, shares experiences, and mentors each other. Um, I feel very strongly that the power of the peer is just as important as the knowledge or authority of a professional like me. Yeah, I feel very blessed and privileged to bear witness to the conversations that happen and to help those conversations along when I facilitate support groups in rare disease. I also want to mention that many of our rare disease advocacy organizations have one-on-one peer support programs, one-on-one mentoring programs. These are often called ambassador programs or peer support programs, where a more experienced family or individual with that rare disease is paired up with a newcomer or a less experienced member of the community, sometimes newly diagnosed. Um, I find, again, power in numbers. I'm often called in to consult to train the peer supporters on how to be in that role as a peer mentor or counselor. And I find that work very rewarding for me, as the people who choose to help typically say, Dr. Al, other people helped me when I was scared and overwhelmed. I want to pay it forward. It's exactly why I'm here. Other people help me. I want to pay it forward. That's why I do the work I do. I encourage you to take part in these programs. And if you have experience as a patient and feel you can help another person in your community, I encourage you to volunteer. Those connections are very strong, they're very meaningful, and they're very powerful. I'm going to finish with a couple more slides. Listening goes a long way. And I put this in here because no matter what the form of support you receive or you give, listening is the most important ingredient, most critical ingredient. Listening doesn't cost any money. So if you're with an organization that doesn't have a big budget and you have people who are available to listen, it goes a long way and it doesn't cost money. You'd be surprised. About once or twice a month, I'll be finishing a therapy session And a client will say to me, Dr. Al, you're the best therapist ever. I feel so much better. You're so good at what you do. You're the greatest, Dr. Al. And I've said about 3 words in the whole therapy session. I might as well be a cardboard cutout. But people feel better when they're listened to, when they're heard, and you're when people are filled with stress and all the thoughts in their head, and they get them out, and they get them out. Somebody who cares and somebody who's listening, it goes a long way. This is really the solution to many issues. It's a very simple solution. But know that when you are listening to a friend, listening to somebody else with a rare disease, listening to a colleague, you're serving them well. And when we're listened to, we feel heard, we feel understood, and we feel better. This is just an overview, a summary of, I've just described to you different aspects of my work. This is a summary of the work that I do on a day-to-day basis. One, helping communities to assess their needs and to build programs to assess and to support the psychological, psychosocial needs of the families. Peer support, I just mentioned support group facilitation and training ambassadors. I do a lot of this work. Um, Last week I did a webinar. Oftentimes I'm doing content delivery by teaching people about mental health, which I hope I did to some degree today. I serve as a consulting psychologist for patient advocacy group leaders and provide direct support to families that are um, uh, referred who need extra support that the group can't um, provide itself directly. Um, I provide consultation to patient advocacy group leaders. It's not easy to run a group. I have so much respect for those of you who run these groups. I didn't have the strength or courage to do it. And I feel honored to help people who do, often also taking care of family members. These are difficult challenges that you all face. And finally, I'm involved quite often in supporting our industry partners who are developing treatments for our rare disease conditions and who are looking for ways to help us. They're specialists in science and research and business, but not necessarily in how to help in beyond the treatment itself. So I'm consulting quite often with industry partners who are trying to do the right thing, wanting to connect with our communities, and want to know how best to connect and support our communities beyond the treatment itself. Finish now with an image of me and my son Jack, who for 26 years taught me most of what I know about this topic, about living with a rare disease, about the experience emotionally of a rare disease. And although my professors in the University of Wisconsin, when I got my PhD all those years ago, were helpful, Professor Jack here, I think, taught me most of what I really needed to know to serve our communities. And I want to finish with a final thought, which is along with the challenges of rare disease, Jack and so many others have taught me that there are a lot of rare gifts that come that are unanticipated rare gifts. Gifts like the gift of perspective. Um, Everybody's big problems got real small when Jack drove his chair in the room. The gift of creativity. We all have to do things differently and think out of the box. We can't do things the same way everybody else does. So we learn how to be creative. We learn how to be resilient. We attract people who are open-hearted and compassionate into our lives. Some of my best friends, and will always be my best friends, are people who chose to get involved and help us because we can't do this ourselves. And finally, connection. Our rare disease communities provide so much support, so much connection, and so much strength. And I finish with those rare gifts as a way to help lift us all up and to remind ourselves that in spite of all the challenges, also are some rare gifts. I hope my presentation today has been helpful. I feel very humbled and very honored to be here. And I hope that some small part of what I said may be helpful to you, to your families, and the communities you serve.